Hi everyone, my name is Dr. Jodian Athena Fletcher, and as part of Sexual Health Awareness Month, today's topic is part of the series on Stay Informed, Your Guide to Sexual Health. Previously, I spoke about pap smears, but today's video will be broader, covering the gamut of what you should know about sexually transmitted infections. The purpose of this video is to provide a valuable resource to promote awareness and prevention of sexually transmitted infections, also called sexually transmitted diseases, as well as to promote safe sexual practices.
Firstly, what is a sexually transmitted infection or STI? These are a group of infections that are primarily spread through sexual contact. These infections can affect people of all ages and backgrounds and are caused by bacteria, viruses, or parasites. They can range from mild, easily treatable conditions to more serious, long-lasting diseases. STIs are typically transmitted through sexual activities involving the exchange of bodily fluids, such as vaginal, anal, or oral sex. Other ways to spread these infections include close skin-to-skin contact or through mother-to-child spread during childbirth or breastfeeding.
Let's now discuss factors that increase a person's risk of developing a sexually transmitted infection.
Sexually transmitted infections can affect anyone. The risk of getting these infections increase in individuals under the age of 25 years, lack of education and awareness of STIs, and individuals not finding out their status through regular testing. Other factors include multiple sexual partners. It is like gambling on the lotto. The more tickets you buy, the greater the chance of winning big. Unfortunately, the same is true with the number of sexual partners an individual has. The more the partners, the higher the chance that one of them will pass on an infection. This is also true if one individual has only one partner, but the partner has several partners. If you are unsure about your partner's status, don't close your eyes and chance it. Use protections. High-risk sexual activities. Certain sexual activities, such as anal or oral sex, can pose a higher risk of STI transmission compared to vaginal intercourse. Let me explain why. Both the mouth and the anus have a more fragile lining that is more easily torn during sexual activity. These small openings can create pathways for the transmission of infections. Also, individuals less frequently use barrier methods such as a dental dam or condom with oral sex. History of STIs. There are several reasons why having had a previous infection increases the risk of another. If sexual practices had not improved, then it is likely to get another infection. Also, some infections either weaken the immune system or cause damage to the genital area, making getting another infection with sexual activity easier. Also, if one partner is treated and the other was not treated, then continuing to have unprotected sex with that partner may cause reinfection. Drug and alcohol use. Even when individuals are educated, get tested regularly, and usually practice safe sex, when under the influence of drugs such as alcohol, individuals can lose their good judgment and make risky sexual decisions. For example, John, who had a stressful work week, decided to go to a club and drink a few beers. A few drinks in, he meets an attractive new partner and takes a risk with unprotected sex with this person. It is good practice to know and respect your limit when it comes to drug use. Also, always have a condom, if there is even a small chance of meeting up with someone. Now that we know that anyone who is sexually active is at risk, what are symptoms that people should look out for? Symptoms of STIs vary widely depending on the type of infection. Some may not cause any noticeable symptoms, making them difficult to detect without testing. Others can cause symptoms such as genital sores, pain or burning during urination, unusual discharge, itching, rashes, fever, fatigue, and more. Untreated or inadequately treated sexually transmitted infections can lead to serious health complications. For example, they can make it very difficult to get and stay pregnant as the infection spreads further and further up the womb, and the individual may have persistent pain in their lower belly. These are features of pelvic inflammatory disease. Also, individuals may develop certain types of cancer, most commonly cervical cancer in women. Other infections will stay and cause havoc in the body if left untreated, such as human immunodeficiency virus, HIV. which can damage several organs and make the individual likely to die from otherwise harmless infections. Many infections can spread from mother to newborn child during the pregnancy or through childbirth through the vaginal canal. Now that you know all about sexually transmitted infections, I am sure you may be thinking, how can I avoid it? The most effective way to prevent sexually transmitted infections is through safe sexual practices, including the consistent and correct use of condoms, limiting the number of sexual partners, and getting vaccinated against certain infections, such as the virus that causes cervical cancer. As it relates to birth control methods, only barrier methods prevent individuals from getting infections from sex. Regular testing for sexually transmitted infections is a vital component of sexual health. Good times to get tested include after risky sexual behavior as discussed earlier, or routinely when dating a new partner. Testing is often simple, quick, and confidential and can occur at a general practitioner, community clinic, or a gynecologist's office. Regular testing is good as early detection of infections can help to reduce the severity of these infections. One common test that should be performed in women is the pap smear, which tests for changes due to the virus that causes cervical cancer. Let's say that life happened and a patient was diagnosed with a sexually transmitted infection. What treatments are available for these infections? Many sexually transmitted infections can be treated and cured with medications once taken as prescribed by their healthcare provider. However, some viral infections, such as HIV and herpes virus, have no cure but can be managed with long-term medication. It is crucial to complete the prescribed treatment as directed by a healthcare professional and not stop medications just because the symptoms have gone away. Also, since the infection is caused by having sex, it is important to either not have sex whilst taking the medications or to use a condom. Also, encourage sexual partners to get tested. Otherwise, there is a risk of getting the same infection again. As with all chronic illnesses, patients with HIV will need to attend regular doctor's visits. Patients will need to take medications for the rest of their life to keep the virus level low. Blood tests such as ones to check the level of the virus, as well as to check for complications, will regularly be done. Once the virus is undetectable, it is far less likely to be spread to loved ones. Overall, patients living with this virus can live long, healthy lives once they stick to their medications and can have sexually fulfilling relationships with their partner. Please see your physician if you would like to get tested for this or any other sexually transmitted infection, or would like more guidance on living a healthy and fulfilling life with HIV. Everyone who is sexually active is at risk of getting an infection. Responsible and safe sex communication with sexual partners about your respective statuses and regular checkups with healthcare providers to get tested are key elements in maintaining good sexual health and reducing the risk of severe illnesses. I hope you liked this video and found it informative. If you did, please remember to like, subscribe, and share this video. If there is a topic you would like me to discuss, please leave a comment below. Thank you and have a wonderful day.